This mini talk is on exercise prescription and progression. On the agenda today is to discuss factors for prescribing exercise, to determine what is the right exercise prescription, to discuss when to progress and when not to progress your exercise routine, and how to safely progress your exercise routine. Your exercise therapist reviews your medical history before and during your exercise program. Your medical history includes both your cardiovascular history, such as whether you're living with diabetes, have high blood pressure, or have had a bypass procedure, and your musculoskeletal history, such as any prior injuries or limitations. It's also important that your exercise therapist reviews your current fitness and activity level. By reviewing your current fitness level or activity level, your exercise therapist will work with you to develop an initial fitness prescription. For example, if you have not been exercising regularly for the past year, your exercise therapist will likely advise you to start with short, light bouts of exercise. On the contrary, if you have been exercising, your exercise therapist will discuss a starting exercise prescription that takes your activity level into consideration. Lastly, during your first appointment with your exercise therapist, you should discuss your exercise goals and preferences. Your exercise goals and preferences will shape how your therapist prescribes your exercise and will help you to get back to the things that you enjoy doing. How to know if your exercise prescription is the right exercise prescription. Cardio-based exercise, such as walking and cycling, should feel somewhat hard. Over time, exercise gets easier, so tracking your effort level is important. You can track your effort level on your exercise diary using the Rating of Perceived Exertion Scale, also seen as the RPE scale, or by using the effort drop-down menu on the Cardiologica app. Resistance training, however, should feel hard. Again, it is important to track your effort level on your exercise diary or in the Cardiologica app. You are ready to progress your exercise program when your goal is to improve your fitness and when your exercise feels fairly light or your RPE is less than 11. Generally, we do not recommend you progress your exercise routine if you have any symptoms relating to your exercise. Symptoms may include chest discomfort, shortness of breath, excessive fatigue, muscle or joint pain, or any other symptoms that exercise provokes. With that said, you may be living with chronic pain. If this is the case, speak to your exercise therapist about when and how to safely progress your exercise. Secondly, if you've had a recent change to your medications, it is important for you to try exercising at the same intensity, at least in the beginning, to ensure the change to your medication does not affect how you feel. And lastly, if your rating of perceived exertion is above 15 or hard on the RPE scale, we recommend not progressing your exercise. Stay with your current exercise routine, and when it becomes easier, you can progress. There are 4 components to progressing your exercise. The first is frequency. How many days are you exercising? General guidelines suggest up to 5 days of cardio-based exercise and 2 to 4 days of resistance training. Secondly is your intensity. How difficult is your exercise? Remember, cardio-based exercise should feel somewhat hard, and resistance training should feel hard. If your intensity is less than that, you could consider options to increase the intensity to progress your exercise prescription. The third component is time. For cardio-based exercise, aim for 150 to 300 minutes per week. If you're accumulating, say, 100 minutes per week, slowly increase your time to achieve the recommended minimum of 150 minutes. Lastly is type. You can consider changing the mode of exercise, for example, changing from walking to cycling, which will challenge your body in different ways and is a great way to progress your exercise routine. Now let's discuss how to progress a walking program. Progressing your walking program starts with increasing your total time. As discussed, current guidelines suggest accumulating 150 to 300 minutes per week of moderate to vigorous exercise. If you're walking 150 to 300 minutes per week and you are ready to progress your exercise, you can consider increasing your walking speed. If you're walking the 150 to 300 minutes and you're unable to walk comfortably faster, speak to your exercise therapist about trying a different mode. As discussed, consider a walk jog program or using the incline on a treadmill, or maybe changing to the elliptical or bike. An important note here is you should not progress two items at the same time. For example, try not to progress the distance and the speed at the same time. So to summarize, I want you to think of one thing you learned from this presentation. You may have learned that your exercise prescription is dependent on your medical history and personal goals and preferences. You may have also learned that you can progress your exercise by considering the frequency, intensity, time, and type of your current routine. For more information, speak to your exercise therapist and visit our website www.gethearthealthy.ca. Thank you.